I'm Malcolm Bryant, and I teach IH 704, which is our core system strengthening class in global health. And if you are interested in understanding how systems are created, how health systems function around the world, this is the course for you. We start off by looking at the 6 pillars of the WHO, applying them to high-income countries, specifically looking at the US, the UK, Japan, Germany, Switzerland, and Taiwan. We then move on to the BRICS countries, the middle-income countries, Brazil, South Africa, China, that group of countries. And then we'll end up looking at low-income countries, and your final project will be focused on those countries, countries like Ghana, Sudan, countries in Haiti, the other countries in the Caribbean, etc. So look forward to seeing you in the spring.
Hi, I'm Laura Sabin, and I'm going to be teaching IH 720, which is Social and Behavioral Sciences for International Health. This is a class that is a required core course. It focuses on behavior change, and ways of thinking about promoting positive behavior change in low resource settings. It includes thinking about and using theories, frameworks, strategies, and approaches to try to address some of the major problems that are occurring today in global settings. Now, we do this through a series of lectures, case studies, exercises, and especially the group work. The group work is really key in this class. Basically what happens is each student is assigned to a broad region of the world, such as Sub-Saharan Africa or Southeast Asia, and then also a major health problem like HIV and AIDS or reproductive health. So each group then over the course of the semester does research and winnows down their region and their health problem to be something that's manageable in terms of thinking about promoting behavior change. So for example, if you're given, Southeast Asia and HIV and AIDS, your group might choose to then focus in on improving or increasing condom use in sex workers in Myanmar, for example. And you do that through doing research and then submitting a series of assignments over the course of the semester, and in showcasing your work through a poster session to which we invite faculty, and also a final report. And there are also a few individual assignments so that you don't have to feel that everything is riding on your group experience. We also bring in a lot of guest lecturers to speak on specific topics that are kind of specialized, like positive deviance and social marketing, for example. And those are always really, really interesting. So it's a hard class. It's a very engaged class. If you bring your brain to work, bring your brain to class and do the readings in advance, I think you'll get a lot out of it. You'll improve skills in research and thinking about behavior change. Your writing skills will improve, and you gain a lot of good group experience. Students in the past have said that they like the class because they get to know people, they get to know me, and they often form a community that they stay with throughout their program. So I hope to see you there.
Hi everybody, my name is Erin Hasselberg, and I'm a Principal Advisor for JSI on PEPFAR's flagship Supply Chain Management Systems project. I'm also the Consulting Services Manager for the bilateral projects that JSI supports out of our Boston office. I'm really excited to be teaching a brand new course at BU School of Public Health in the first half of the spring semester entitled Supply Chain Management for Improved Health System Performance. Have you ever thought about how every major public health intervention has relied on a product or a commodity? Malaria programs rely on rapid diagnostic test kits, rely on malaria treatments, TB, HIV, family planning. And we have a phrase at JSI that we say, if you don't have a product, you don't have a program. And this course is going to provide you with a baseline introduction to supply chain management for public health. Classes are going to be very applied and use real examples from JSI's 25 years of working in supply chain management. We're going to utilize both lecture, small group, case study, and even a simulation of a supply chain in country to stimulate learning and engage all of you. In addition to a few quizzes and some homework exercises and reading, of course, your final project will consist of selecting a supply chain issue or program of your choice, putting together a poster for a round-robin, energetic poster presentation for the very last class that will be shared both with JSI's president, Joel Lampstein, as well as other faculty from BU School of Public Health. So I look forward to having 28 of you enroll in this course and hope that you're as excited as I am about seeing what we can do for supply chain management and public health. Thanks.
IH 741 is an intensive short course offered during Spring Break Week, which provides an overview of the consulting industry in international health. And frankly, many of our assignments will be consulting because there are many short-term assignments, and many of the skills are relevant to any of those assignments. We'll review the structure of the industry, how contracting opportunities are developed and identified, strategies for bidding, and most importantly, you will write a proposal which is in response to a real RFP, and you will be able to see the work that needs to be done by reviewing the report that was actually created out of that consulting assignment. So you'll learn budgeting, you'll learn work planning, and you'll learn how to sell yourself and your team. Finally, in the last day, we divide up into groups. Each is given a recent consulting or research report, and you have to present a short, concise executive summary to the class because it's extremely important that you be able to condense your work into something that is brief and understandable, hopefully like this video.
Good morning, afternoon, or good evening, whatever time of day it is that you're watching this. This is Malcolm Bryant. I'm on the faculty of the International Health Department, and I teach IH 743, implementing health programs in developing countries, making programs work. I'm here to sell this course to you. So if you are interested in making programs work in developing countries, if you like to work hard, if you love working in groups, and you don't mind putting in a lot of time out of class, this is a great course for you. It is hard work. It's all group work, and it is all practical. The way the course is set up is that you work with an organization in a developing country, in a team. The organization has a real problem that it needs solving, and it is asking you, a student consulting team, to address that implementation problem for them. The problems come in different flavors: human resources, quality improvement, drug logistics or other forms of logistics, information management, and financial management. They set the scope of work. You use the skills you've developed in class, come up with a set of deliverables for the organization, and they are then able to look at the deliverables you've produced, provide feedback. You can modify it if necessary, and ultimately they'll be able to use that to solve the problem that they're facing, whether it be recruitment of a new person, developing a monitoring and evaluation system, or whatever. It's a very popular course. Sign up early, and look forward to seeing you. Bye for now.
Monitoring and Evaluation of International Health Programs, or IH 745. As global health professionals, we tend to rely on interventions to influence changes in attitudes, behavior, and practices in a way that can lead to a long and healthy life. But how do we know whether the interventions are achieving their goals? How do we know whether the interventions are being delivered in time, in the way as intended, or to the people who need them the most? How do we know whether the individuals are adhering? How do we know whether the interventions are leading to the impacts in the direction or in the magnitude as anticipated? For answers to questions like these, we use monitoring and evaluation research. In IH 745, students will learn hands-on technical skills to propose a monitoring and evaluation design of a global health or a social welfare program of their choice. In specific terms, students will learn about logic models, experimental and non-experimental designs, survey instruments, sampling strategies, database creation and management, and monitoring framework. Students will also learn how to work with their peers or even how to lead them, and how to peer review a monitoring framework and evaluation design.
Hi, my name is Dr. Monica Onyango, and in the spring of 2014, I'll be teaching IH 755, which is Public Health Management of Disasters and Complex Humanitarian Emergency. And the reason we teach this course is because in recent years there's been an increase of disasters, especially natural disasters and violent conflicts which displaced populations and put their health at risk. So this course, we teach students public health response to these kinds of situations where there are large numbers of populations moving either internally or as refugees. We teach response, how to conduct assessments, and how to implement or intervene with basic services which are needed in these situations, like water, sanitation, nutrition, logistics, and we also touch on issues around donors, because you need money to be able to respond adequately in these situations. Students also learn how to live and work in these kinds of environments, especially refugee camps or internally displaced population camps. In this course, we also have various assignments which will be included in the syllabus, but we have a final project which students work on in groups, and they present a paper, and they also do presentations in front of faculties where they are given feedback on the work they have been able to do during the course of semester. So if you have any further questions, please contact me, come to my office, and we'll be able to talk some more about it. Thanks.
My name is Taryn Vian, and I'm teaching a course, IH 757, which is Fighting Corruption Through Transparency and Accountability. A lot of students will be working in health organizations and might encounter corruption in their work. They will need to learn to work in situations where corruption is prevalent, but also how to make individual ethical decisions when faced with problems. So this course talks about the problem of corruption, how it's defined, how abuse of power can be prevented through health system strengthening, through transparency initiatives, giving the public access to information, and through different other sort of systematic interventions. The sessions of the course at the beginning cover some of these principles of anti-corruption or fighting corruption. We also do a few topics courses. One is under the table payments to doctors in developing countries. Another topics course is physician-pharma interactions, physicians working with industry. That's very relevant both to in international settings and in domestic health care. And then we have a session on corruption and culture, cultural issues that we need to consider when trying to fight corruption in developing countries. There are homework assignments and a short exam that will be in the course. It's just a 6-session course, 2 credits. Thanks.
Hi. My name is Bruce Larson. I'm an economist here in the Department of International Health. I teach IH 770, Poverty, Health, and Development. This course is organized into 4 main sections. We first talk about poverty. What is poverty? How is poverty measured? And how do international organizations think about interventions to reduce poverty? Then we focus on health. The students in the School of Public Health already know quite a bit about public health programs and health problems in developing countries. But the course is designed also for students in the economics department and in the global development policy program. So they don't have so much health background, so we need to bring in the global burden of disease type information so that people have a better handle on core international health problems and how poverty and health are interrelated. And then economic development is really one main channel through which both poverty alleviation and health improvements are hopefully going to occur. And so we explore that literature to see really what the role of development is in reducing poverty and improving public health. And towards the last part of the course, we really focus more on specific interventions and specific strategies different organizations have been trying to pursue to both support economic development, reduce poverty, and improve public health. The course has a lot of economics in it, but I don't presume you know too much economics at the beginning. We work through a lot of empirical literature that will, if you don't understand the methods, will kind of explain how to interpret the stuff. But you need to come in willing to learn, and you pretty much get out of the course what you put into it. There's a lot of readings, there's a lot of materials that you'll need to work through, but I'm not going to force you to look at them. I'm not going to look over your shoulder to make sure you've done it. So what you put in is what you'll get out of the course. And you're welcome to come in and talk to me before the course to see if you're interested in it.
Okay, you're ready.
Hi, my name is Taryn Vian. I teach IH 773, which is Financial Management for International Health. There are 3 topics in the course. We cover cost analysis, reading financial statements and reports, and budgeting, how to develop a budget, how to monitor a budget. There are a lot of case studies in the course from my work overseas and the work of other people. And we have exercises, many homework exercises and in-class exercises. About 60% of the course is graded on these homeworks, and 40% is on a midterm and a final exam. Students like this course because it's very practical. You learn a lot of skills that administrators need who are working in health programs. So when you become a health leader, you need to understand financial management to talk to other financial managers.
Hi, I'm Jennifer Beard, and I teach IH 777, the Culminating Experience Writing Workshop. And the entire course is designed around you conceptualizing and writing your CE in 3 to 4 drafts. You need to have at least 25 credit hours in order to take the class. And the entire course is based on extensive feedback from 2 faculty members and peer review, and basically everything you need to write the paper. This is a course that you should take if you are somebody who needs structure, hard deadlines, and a sense of community, who wants to be able to meet with people occasionally and talk about your paper, where you are, etc.
Hi, I'm Kirk Dearden, and I'm a professor here in the Department of Global Health. I teach a class, IH 71, focused on global nutrition. It's an important class because nutrition is an underlying determinant, the major underlying determinant of child death in the developing world. And also because BU doesn't offer any other courses in global nutrition. I think you'll enjoy the class. I think that you'll learn some things about factors that affect nutrition that aren't covered in any class, including water, sanitation, and hygiene, agriculture, early childhood development, and so forth. One of the nice things about the class is we take a case study, and it's a country of your choosing, and we walk through the process of looking at the epidemiological evidence and looking at feasibility studies, looking at policies, and then trying to develop a program for a developing country on nutrition-related issues. So obviously I'm biased, but I highly recommend the class and hope to see you there. Thanks.
Hi, my name is Professor Christopher Gill, and I'm going to be teaching the IH 800 course, which is called How to License a Vaccine Through the FDA. So the purpose of this course is to give students kind of a hands-on, fly-on-the-wall experience for what it's like to do clinical development in a regulated environment. So the way this class works is that the students are assigned to groups, and at the beginning of the course, they're given a series of 4 antigens that have just been tested in bunny rabbits. And they have to then decide which of these antigens is the one that they think should go forward into clinical development. We then essentially write you guys a blank check for $300 million, for which you then buy clinical trials. And over the course of 8 weeks, you run an entire clinical development program with me generating all the results for the trials that the students propose. And at the end of that, you submit a biologic license application, and hopefully it gets approved, and everyone is saved in the world, and public health goals are met. It's an interesting class. We think it's a hard class. It's an 800 level class, so we'd expect you to have to work. We also need you to know a little bit about epidemiology and biostats before you come in, so those are the two requirements, basic epi and bio. Other than that, come prepared to learn about vaccines and immunology and clinical trials, and to think hard. See you there.
Hello. If you are going to work in global health and want to make yourself attractive to prospective employers, take our course IH 804, Using Mobile Technologies to Improve Health Outcomes. IH 804 is taught by Jonathan Payne, an entrepreneur and experienced mHealth practitioner, Marion McNabb, the director of mobile technologies at Pathfinder International and a doctoral student here at BUSPH, and myself. mHealth is new, and global health organizations are scrambling to integrate the use of smartphones and tablets into their public health programs. BUSPH was the first public health school to develop and offer an applied mHealth course, and students graduating from BUSPH have already found jobs in the mHealth field. In this course, you'll work as a consultant on a team with an organizational client to build an mHealth application for your client. You'll learn how to design, develop, and refine mHealth intervention based on real-world business need. By the end of the course, you'll have developed an mHealth application that runs on a phone or a tablet. The course will also provide you with an opportunity to explore current state-of-the-art in this field, examine the evidence for the health impact of mobile tools, and provide insight into leveraging mobile health data and scale-up of mobile solutions. By the end of the course, we hope you'll have become an mHealth expert, equipped with the mHealth tools to make a difference in your own public health practice in an informed and systematic manner. So join us in the spring of 2015, for IH 804. Build your mHealth skills and get immersed in this exciting world of mobile technology.
Okay. I'm Kojo Yabuantri, and I teach IH 805, which is global control and eradication of infectious diseases. The prerequisite for this course is to complete the SPH core courses of epidemiology and statistics. The course is taken in the second half of spring, from mid-March to early May. And the objective of the course is fourfold. One is for students to learn about a series of infectious diseases of public health interest and importance. Two is to help students understand infectious disease control in different populations. Three is to improve the understanding of infectious disease control, elimination, and eradication. And then the fourth is to develop or enhance student skills in critically reading a primary paper to help people to make decisions on their own.
Hello, my name is Andrew Stokes, and I teach GH 811, Applied Research Methods in Global Health. This course focuses on research methodology, both qualitative and quantitative. The exciting thing about this course is that we will actually implement primary data collection and analysis throughout the semester, culminating in a final report with your findings and recommendations for policymakers. You will design a questionnaire, you will administer it, and you will enter and analyze the data using a statistical programming package. You will also use qualitative approaches, including semi-structured interviews and/or focus groups. I really hope you join me, and please let me know if you have any questions. My door is always open. Thank you.
Hi, I'm Joe Anzalone, and I'm here to tell you about IH 854. And the official title of that course is From Data to Dashboards, Building Excel Skills to Support Health Programs. This course is taught by Liz Lewis, who's an adjunct faculty person. Liz is the lead analytics for the whole analytics team at Harvard Pilgrim, a big health insurer in Massachusetts. She has an incredible amount of not only domestic experience, but also international experience in building Excel models and dashboards in a variety of different global health situations. This course meets Thursday afternoons. It's for 2 credits, and it's held the first half of the semester. It is designed for upper level MPH students who already have basic Excel skills under their belt. We use Excel to teach people how to build dashboards. So what is a dashboard? Well, essentially, a dashboard is a way to take critical programmatic information and organize it, analyze it, and present it in graphics and graphs so that a manager at a glance can look at the data and see what's going on, what needs attention, what deserves more focus. So this course would be great for a student that already loves data and wants to fill their toolkit with more functionality in Excel. So we will learn Excel functions like range names, counts, VLOOKUPs, text and logic functions, conditional formatting, and yes, pivot tables. It will help you think about some of the best ways to display data. Not every way that you display data makes the most sense, so it'll teach you to be more critical in how you present data. It contains a group project as the final part of the program where you'll have a data set and analyze it and create a robust dashboard that would serve the manager for that particular program. Lastly, this classroom is flipped, meaning that the lectures, the formal part of the course, actually is videotaped by Liz, and you watch and learn whatever the lesson is for that part of the course on your own time. And then when you come into the classroom, that's the chance to work on either homeworks, problem sets, or a group work activity with the faculty and the instructors right there to help you whenever you get an issue you don't understand, a problematic situation. So we help you move along. So that in a nutshell is about IH 854.
One of the courses I teach is IH 888, which is, I think its official title is Seminar in Health Policy. It's actually evolved a little bit over time to become more of a skills-based course. So we spend the first, it's 7 sessions, so it's just half a semester. We spend the first part of the semester reviewing how policy is set, how a particular issue gets on the agenda or not. Sometimes issues are kept off the agenda. The nature of power, who holds power, and what is the basis of their power. We also look at the role of the state, the role of governments, specifically in healthcare. And then we use case studies and examples from actual things happening to sort of examine how these different actors are playing, what is the context of the policy, what is the content of the policy, and what is the process that's being played out in order to have a policy either be adopted or not. And then we look at actually making policy. The student's assignment is to choose a policy and go through the steps of policy analysis. So they look at defining who are the actors and the stakeholders, what is their position, the source of their power, their source of funding, how they interact with other actors. We look at the content of the policy. Is it something that's kind of simple and likely to be easy to implement, or is it complex with a lot of moving parts, potentially a lot of different opposition parties and so on. And so at the end of it, I think students come out with a pretty deep understanding of how policy is formed, how they as public health practitioners can actually influence policy making, and if they think that they're going to be playing a role in policy making at some point in their career, I think it gives them some really good tools in order to be very effective at kind of organizing the policy making process in a workplace or any other kind of setting.
Hi, this is Warren Kaplan. I'm teaching 891 Global Pharmaceutical Policy. You and I and everybody else in the world who studies global health is right in the middle between process, policy, and politics. And I think we all have to be comfortable with being in that intersection of those 3 circles. This course is about how to deal with that. There are 8 sessions. It's 2 credits. We're going to do an introduction. We'll talk about the role of government setting in agendas using something called the Priority Medicines Project. We'll talk about global intellectual property, patents, and trade. So these are big issues in pharmaceutical policy. How do you regulate palliatives and opioids? Whether countries should make their own medicines. It's not obvious that countries should be making their own medicines. Monitoring and evaluation of pharmaceutical policies using China as an example. E-cigarettes, it's a big issue in the US. This session will be in preparation for a simulation on the last session, which is a mock conference in front of the Health and Human Services Committee of the United States government, in which we're going to decide and argue whether or not the US government should regulate e-cigarettes. So this is an overview of pharmaceutical policy, all very, very important issues. We'll do methodologies as well, and I look forward to seeing people in IH 891. Thanks.